Hi, my name is Teresa Cox, and this is my final capstone
Hello,
presentation.
my name is Marian Hudson, and this is my capstone educated citizen presentation for the BSN program.
Hello, my name is Jared Kaufman, and this is my capstone presentation.
Hi, my name is Kennedy Rogers, and this is my final capstone presentation.
My public issue is breast cancer screening.
The mental health of African American youth.
Is prescription drug prices.
Was homelessness in Minnesota.
I chose it because it is a common struggle among my patients who are usually beneficiaries of Social Security and Medicare.
This is me in the picture. Breast cancer screening is important to me because I was diagnosed when I was 50.
So I chose this issue because homelessness is a solvable health crisis in America. However, the resolution to homelessness is not prioritized by the policymakers in our country.
As a Black woman, I dealt with mental health issues in my youth that directly related to my race, discrimination, and socioeconomic class. I am also a mother to 6 children who are each dealing with their own issues.
The Minnesota Homeless Study found that homelessness has been on the rise since 1991.
The American Cancer Society reports that breast cancer is more prevalent than any other type of cancer in Nebraska. Nebraska women are diagnosed more often than the national average.
In 2020, Dr. Rachel Kliss-Holbert reported that there had been an over 70% increase in suicide rates since the 1980s among African American teens, and that African American children were significantly less likely to get help with their mental health concerns.
Nationwide spending on prescription drugs has increased from $30 billion in 1980 to $335 billion in 2018. An estimated 18 million people cannot pay for even one prescription medication for their household.
Code switching is a term you may not be familiar with, but it is the ability to change the language you use to fit the situation at present. While remaining professional, I was able to use a dialect and terminology that the patient was comfortable with to help all parties involved. It is our job as nurses to ensure that we are adequately conveying information and minimizing the chance for miscommunication to happen. This is where the educated citizen's ability to effectively communicate becomes an important factor.
I had a patient at my job who was not oxygenating well and was going to require intubation to have a chance at survival. The patient was very apprehensive. Even after extensive education, from this experience, I learned the true meaning of patient-centered care. It was up to the patient, since she was coherent and understood the consequences of not being intubated. Respecting the patient's wishes is essential to our healthcare system, and I learned how to respect those decisions. Looking back at prescription drug prices, in my journey to change them, I will come into contact with individuals who think differently from me. It is important to respect these opinions.
Working with the mobile diabetes bus was an important experience during my clinicals. It allowed me to directly interact with and care for individuals of several populations, including people without stable housing or access to healthcare. Possessing adequate access to healthcare is crucial for positive health outcomes to occur. Vulnerable populations, like unhoused individuals, have the most difficulty accessing health services. Therefore, bringing diabetes screenings to community members was a crucial aspect of expanding access. Bringing the opportunity for healthcare to the communities in need is important in achieving accessible and equitable care, and a step in breaking down barriers that many homeless people face.
I had a patient who had unmanaged pain. She had came into the ER. They gave her some oxycodone. They sent her upstairs with a diagnosis of cellulitis. When we assessed her, she claimed that her pain was a 6 out of 10. When we went back in to tell her that the ultrasound was inconclusive and that now we were going to do a CT scan, she seemed agitated. And so I asked her, what her pain was then, and she then reported it as 8 on it. When we went outside of the room, I asked her, the nurse, were we going to do anything? Could we call the doctor? And reminded her that we hadn't given her anything for the pain, and now she was reporting her pain as an 8 out of 10. And so the nurse then called the doctor, got a PRN medication we were able to give her. So what I learned that day is that by bringing my concerns to the nurse, I could be a voice for the patient. I can advocate for my patient and what they need.
To conclude, I'd like to say that it is imperative that we address the mental health of Black children. The sheer number of those committing suicide or the adults that admit they had undiagnosed anxiety and depression as children is something we cannot ignore. It is my duty as an educated citizen to understand that without fighting for this population, we are failing them. Black children, in addition to learning who they are, deal with transgenerational trauma, racial discrimination, cultural stigmas, and more. It is my duty to advocate for these children.
I am excited to continue to grow as an educated citizen personally and professionally in my job as a respiratory therapist. I want to thank you, Nebraska Methodist College, and my instructors for giving these opportunities. I look forward to my future adventures.
I have learned, grown, and I believe developed into a prominent, educated citizen who has and will continue to communicate effectively, reflect supportively, and influence change in the communities in which I live and serve.